Hi, I'm Dr. Aguilar, Oscar Aguilar from Texas Integrative Medicine and Cardiology in El Paso, Texas. As all of my colleagues, I am very concerned about the situation that is coming up in the world right now and that has been going on for the last couple of months or so. This is a video that would like to put into perspective two important things. Where is this pandemia? What is the past history of pandemias? And second, how can we fight against it? The number of patients infected in the world keeps going up. Right now, the latest number was around 267 or 268,000. There's a lot of fatalities from those infections. Now in the United States, the number keep going up. Fatalities keep going up. And sometimes we hear that people mention that there's not been a pandemic like this in the past. However, in 1918, there was a flu pandemic. N1H1 infected the world, pretty much the biggest pandemic in the history of humankind. Approximately 50 million people died. Approximately 500 million people in the world were infected. That gives a fatality or mortality of around 10%. This current virus, we call it coronavirus, behaves in similar ways to that N1H1 virus. Therefore, these numbers for us are very important to keep in mind. There's a recent study performed by the Imperial College of London that was published just about 3 days ago. The Imperial College of London is a major authority when it comes to public medicine. In this report, they're comparing this pandemia to the pandemia from 1918. And it's very important to keep in mind this. There's two possible scenarios. One, social distancing, which is what we're trying to do in the United States at least, which we call it mitigation of the infection. The other one is true lockdown, which we call it submission of the infection. In the first scenario, which is what we currently are doing, that study estimates that we can probably have a mortality in the United States close to 2 million people. In the second scenario, which is of course much better, but more strict, the mortality may be around 1 million. In any case, the scenarios are not great, and I think we need to be very serious about what we are doing. On this regard, I don't want to wait for the government, like California, to enforce a lockdown. Let's just try to put in practice as much as we can. I would suggest that you have one person in the family in each home being the designated driver, someone that goes to the supermarket, to the gas station, to do those absolutely indispensable activities for a household. This person should go out and come in a proper way. And if you do not know how to do that, please refer to the CDC website for instructions. The other one that we have to talk about, which is imperative, is the fact that viruses are not treatable. We don't have a medication that kills them. Right now, they're talking about 5-6 medications that are showing some possible benefits, but we are not there. And we cannot say of any specific medication to kill the virus. It is extremely sad, difficult to understand, that we are in an era in medicine where we can do vital organ transplants. We can save lives of people dying. We can change a valve in the heart without opening the chest. But yet, we don't have a medication against a virus. We have antibiotics for bacteria, but antibiotics don't do anything against viruses. The only thing that would stop this spread of infection is staying at home. You've been hearing this on and on and on throughout, TV, websites, etc. I cannot overemphasize how important it is. And I would strongly suggest that you follow what California is doing. Something similar to a lockdown. Stay at home. Let us, health providers, take care of this as best as we can. We're here for you. The second aspect of this video is to tell you something very basic that I'll tell my patients on a daily basis. The immune system is the only way that we have to try to kill inside of us the virus once we've been exposed to the infection. That's it, the immune system. So we have to have a strong immune system to do it. Those people with a strong immune system are going to prevail, they're going to do fine, and it's estimated that around 80% or so of the population is just going to get a little flu, maybe a cold, that is insignificant. However, that leaves another 20% out there that may get very sick. And as we're seeing in Italy, China, Spain, and other countries, they cannot really take care of all the people. And very tough decisions are being done. We don't want to get there. Do not want to get there. To make sure that the immune system is strong, you gotta eat right. Do not call it eat healthy because nobody knows what that means. I'm going to tell you what you should do because this is scientifically proven. You have to make sure that you eat a lot of vegetables. Go to dirtydozen.com, find out which vegetables, very few vegetables that you have to buy that are organic. Most of them you don't even need to buy organic. And try to make 70% of your meal plant-based. The other 30% or so, try to do a combination of some protein. It can be beef, it can be fish, but you have to be careful where it's coming from, the source of it. And last, try to make sure that you avoid, at all possible, a lot of refined sugars, sweetened drinks, artificial sweeteners, cereal, too much milk right now. All of those things that we consider healthy sometimes that have too much sugar should be avoided. And stay active. Now that we are supposedly at home, you gotta stay active somehow. If you have a good idea, if you have a gym at home, please stay active. If you do not have an idea and you don't have a gym, try to go on those websites that help you doing exercise while at home. This is a very important time that reminds us how frail we are and how important it is to follow these advices. The best advice should come from the CDC official website. In the screen, our website is going to appear. There are other videos that we recorded before this happened about the immune system, about microbiota, and multiple topics that should help you, especially now that you should have a lot of time to watch those and learn. The purpose of those is to teach you guys, to learn together. We're in this together. We're on the same boat. And we have to prevail. I send you my best. Also, you're going to see on the screen my email. I've been getting lots and lots of emails, questions for friends, phone calls, texting, chats, and whatever else. Feel free to ask whatever you want, and as much as I can get to it, I'll be happy to answer those. We can also offer telemedicine for those people out there that feel that they would like to talk to us. We'll be working tomorrow and anytime, any given day, and we're here for you. Send you my best.